Okay, so we're going to demonstrate one of the concepts of the exercises here and how we correct the rotation component that we teach for the patient of their right thoracic spine for Brooke's specific curve. So what we're going to do here is we have Brooke set up where she has traction being applied from her hips. We have a strap here that gives her the ability to move. When you go see a Schroth therapist and you do Schroth scoliosis therapy, there's going to be a lot of steps, and you're going to learn steps on how to elongate and work from the bottom up. Make sure you're in the right pelvic position, and going to a certified Schroth therapist is really important so you get the right therapy and the right classification for the right exercises. What we're going to do here, this is not meant to treat or diagnose any specific person, but it's to show the way that we would teach the exercise and our ability to listen and educate a patient on that. So what we're going to do here today is Brooke's going to work with this little green ball here, and we're going to put it under here, under her left rib here. We call this the ventral prominence, and we're going to put that little green ball right underneath her left rib there. Now, we're using rolls here. People can also use bean bags because we're in the pandemic. Towel rolls really work well because we're able to clean them and wash them in and out, but others that may be looking at this and have done Schroth before may say, oh, well, I use bean bags. It can be either as long as you're doing the correction right. So Brooke has been educated on making sure that she lifts her right chest forward and up. And when she does that, we're not just correcting in one plane of movement, we're correcting three-dimensionally. So the left side here is going side and back as these ribs are going forward and in. And so this is one of the ways that we work on this exercise is that we work on breathing. So Brooke's going to take a big breath in as she elongates her head up and forward. And she's going to breathe out. And she's going to push into this area here from a sideward, backward direction. She's going to make sure her right hip stays down. That's why there's a roll here to make sure she's not going to substitute her lifting up of her right rib cage forward in with her right hip. And again. Excellent. Brooke, you're going to keep going, and we're just going to explain another part of your curve. So Brooke has a curve in her right part of her body, and like we said, we're trying to move that right curve forward and in, this left side, side and back, and then as she's exhaling, she's going to be pushing out with her right elbow, providing what we call counter traction. That's going to allow her to correct the left upper curve, so she's not just correcting one curve, we're trying to get the whole spine to be straight.